Regardless of why people are entering into a hospital space, it is stressful on their bodies, whether it be stressful in their mind or stressful from a healing perspective. And that's why it's important to have different areas and different spaces throughout the facility that are going to create a calming and healing environment. One of the things that we're thinking about is how this building serves patients and helps patients heal.
Oh gosh, if you're a child, if you're an adult, if you're anybody, going into a healthcare setting can be very scary. There's a lot of anxiety to it.
We wanted to create an experience for women that was really focused on elevating that, so having a little bit of a higher end hospitality feel to it, making it feel a little less institutional.
Creating a space that's quiet and calming is something that's a challenge. A hush curtain is going to be a traditional privacy curtain, but with acoustical panels built within. Patient safety, visitor safety starts at the entranceway. Entrance flooring systems help by making sure water and debris does not make its way into where somebody could potentially trip. Quick lock handrails are a patented installation method provided exclusively by Construction Specialties. With the turn of a wrench, a handrail will lock on the wall, reducing your installation time by over 50%.
I can definitely say that Acroven was a very flexible product. I couldn't even tell you how many unique colors we have on this project. It's probably upwards of 15.
It's a vibrant product that can withstand time. And it's okay. If you want to switch out color, it's easy to do.
Before, it was a long, very long hallway that was all beige.
It was just very dull. That was the biggest complaint with the children. They were going into a scary situation. This was not helping.
We installed about 140 panels along the entire hallway. So from floor to ceiling, interactive artwork for the patients to touch and imagine.
And it takes your mind off of all your other thoughts and puts you in a whole nother space.
This wonderful material that we've used called Acroven, which is totally indestructible, basically. And so this is going to be here for a really, really long time.
Aside from creating a welcoming and healing space, we also want to create a space that keeps occupant safety in mind.
So in the event of an earthquake, it's absolutely critical that this facility remains operational. People can be treated in the event of an earthquake. So one of the real inspirations for the structural engineering, at least behind this project, was ensuring that level of resilience.
Loma Linda is a very unique building. It's one of the most seismically advanced buildings in North America. Construction Specialties was invited to help develop the seismic bridges that connect the building structure to the landmass. The building structure was designed to be a base isolation system and be able to move approximately 4 feet in any given direction. This building has been designed in such a manner that it will be up and operational under what might be considered to be the most catastrophic earthquake that we've ever seen. Could be life-saving for many, many people.
What truly sets us apart from other manufacturers and other suppliers in the space is that CS not only provides those types of products, but we support them end to end.
So the big concern that was brought to our attention at the start of design was really that the nursing staff needed to have a clear line of sight to the patient at all times. They didn't need to wait until an alarm went off to figure out that the patient needed their assistance.
Very rarely do you find sort of installation and fabrication partners that are going to be with you up front in the innovation process and carry that all the way through to the delivery process.
So we started clipping the corner of the bathroom. We still had some traditional swing doors in there. And what really came about was if we could get a curved door in there, that would give the line of sight. It would maximize the space of the bathroom to make sure that we meet the ADA clearances and all the other requirements of a healthcare bathroom facility.
I really want to give CS a lot of credit for that, because at no point did they sort of flinch and say, we're going to go with a traditional bar and leaf door. They worked with us to make sure that the door that everybody envisioned was delivered.
We are Construction Specialties, and Specialties is really at the core of what we do. try to hunt and find what unique solutions and ideas haven't been thought of yet. And that's where we partner with architects, interior designers, and owners of hospital spaces to constantly push that envelope and ask for something to help us grow and evolve and become the new CS of the future. CS has been in the healthcare space since 1948. We've done hundreds of projects across the globe and have products that have lived in those buildings and withstood the test of time.
So what makes Construction Specialties unique is their creativity.
I mean, CS is never stagnant in the market.
Everyone across the board was really passionate from the get-go.
It's a different thing. You're not out there building like a warehouse building. You're building something that provides patient care.
People feel that safety in the time of their greatest need, right? Which is typically when they're in a hospital. Fundamentally, you know you're making a real difference to people's lives.
When you have a unique design problem that you're looking for a solution for, that's when you call CS.